Hello and welcome. I am Dr. Alvaro Garcia. Today, I want to talk to you about umbilical hernias. What's an umbilical hernia? An umbilical hernia is a hernia that appears in the center of the abdomen where the umbilicus is. It's a congenital defect that over time can grow and cause symptoms. What are the most common causes of umbilical hernias? Generally, most hernias are produced by an increased pressure in the abdominal wall or a weakness in the abdominal wall. And a combination of those two create the hernia. For example, if you lift heavy weights, you might result in a hernia. How do we repair hernias? We repair the hernias three ways: in an open fashion, laparoscopic fashion, or robotic assisted fashion. The old-fashioned open umbilical hernia repair requires an opening by the umbilical area and closing with sutures. Sometimes it might or might not necessarily need to be reinforced with mesh. The new techniques include laparoscopy and robotic, in which high technology allows me to close the defect in a way that is otherwise close to impossible. Also, the defect is reinforced with mesh behind the muscles. This prevents all the complications that you heard about mesh. What is the recovery time on umbilical hernia? If it's done open, within a week you should feel better. If it's laparoscopically, it could be much faster than that. And the fastest way is the robotic one. Also, every patient, it will have an indication for either open laparoscopic or robotic. And that will depend on the characteristics of the patient and on the hernias. Again, if you have any questions about hernias, umbilical hernias, or the techniques involved in the repair, please do not hesitate to call us to the number that you see below or send us an email, and we will respond to you as soon as possible. And again, thank you for listening.